Alzheimer's disease and cognitive decline are becoming an epidemic. But there's good news. The most recent studies show there are big things you can be doing to lower your risk factors. And even more importantly, there is now evidence that symptoms can be reversed. This is information you need to know for yourself and for the ones you love. So I'm here today with Dr. Nate Handley, who's triple board certified in internal medicine, medical oncology, and integrative medicine. Welcome, Dr. Handley.
Thanks, Dr. Monti.
What I'd like to get into with you today is this epidemic of dementia, Alzheimer's disease, cognitive decline, because it's something that people are thinking a lot about and are really concerned about.
Yeah, I think it's a really important topic. And currently, there are about 6.5 million Americans who have been diagnosed with Alzheimer's disease, which is a lot. That's just one form of cognitive decline. And I think what's more concerning is that number is expected to double by 2060. And so we're really kind of entering a period of an emergency when it comes to cognitive health in this country.
Those are big numbers. And I know a lot of people are thinking, what if I notice that I'm forgetting where I put the keys? Does this mean I must get full-blown Alzheimer's disease? Is that the direction that this always goes? And is there anything I can do about it?
Well, I think the good news is that we're also learning that many of the things that lead to cognitive decline are things that we might be able to modify. And in fact, it seems that about 40% of cases of cognitive decline may be reversible based on kind of lifestyle modifications. And so there's a lot actually that you can do to reduce your risk of cognitive decline.
So I guess the earlier you address those things, the better?
Absolutely. And so the thing is that some of the changes of Alzheimer's disease can actually develop decades before symptoms even develop. And so we think of Alzheimer's and cognitive decline as something that happens in people who are in their 60s, 70s, 80s. But some of these brain changes can actually happen in people's 30s and 40s. And so the time really to start thinking about prevention, whatever age you are, is probably now.
But isn't it really a matter of genes? Because we're told that for things like Alzheimer's, there's a strong genetic component. And so if you've got that genetic predisposition, doesn't that pretty much mean that's what's going to happen?
Genes are important, but they're not the whole picture. It is true that there are genes that are associated with increased Alzheimer's risk. And in particular, there's a gene called ApoE4. This is a pretty common gene, and about 25% of the population carries one copy of ApoE4. If you have one copy of that gene, then your risk of Alzheimer's disease goes up by 2 to 3 times the general population. If you have 2 copies, which is about 1% of the population, it goes up by 12 to 15 times. But again, genes are not the whole story here. And even if you have that gene, it's by no means a guarantee that you're going to develop Alzheimer's. And in fact, people who carry that gene may be the ones who are most likely to benefit from dietary and lifestyle modifications to further reduce their risk.
So by benefit, that potentially they could change the course that gene is pushing them on.
Yes, absolutely. These genes are not written in stone. They are what I think of as modifiable. They're genes. The genes themselves are not, but the impact of the genes downstream may be.
I guess for somebody with a family history, then they might want to know if they have one of these gene variants so that they can be all the more diligent about some of the things that could prevent the cognitive decline.
I think so. I think for people who have a family history of dementia of any form in their family, it's a good idea to do this testing because that gives you information that you can then act upon.
So let's get into that action, these lifestyle things that you're talking about. And are they really proven to have any kind of impact?
Yeah, it's a great question. So there are a lot of different things that we can think about when it comes to cognitive health. One of the biggest ones is diet, actually. And there are several types of diets that may be helpful to reduce cognitive decline. The classic one we think about is the Mediterranean diet, which is kind of a general anti-inflammatory diet. But there are also a few diets that have been specifically studied for patients with Alzheimer's disease. One of the diets that we think of is the Mediterranean diet. So this is kind of a classic anti-inflammatory diet that has been demonstrated to be helpful for cognitive decline. And in fact, there have been several studies recently that have looked at variants of the Mediterranean diet. So one of those diets is called the MIND diet.
Mind.
MIND, M-I-N-D. And so this is kind of a combination of a Mediterranean diet with a DASH diet, which is another diet that has been looked at for reducing blood pressure for people who have hypertension. And so this diet is one that has been found to reduce risk of cognitive decline over time. But it's not the only diet that has been studied. There's another diet that was developed by someone named Dean Ornish, which is essentially a vegan diet. It's a very low-fat diet. And this has been studied in actually a recent randomized clinical trial. And participants in that trial showed not only reduction and worsening of symptoms over time, but they had improvement in cognition over a 20-week period of time, which is something that we really don't see in Alzheimer's studies. And so
this was a group of Alzheimer's patients.
This was a group of Alzheimer's patients.
Wow. And so these different diets, Mediterranean, MIND, the Ornish diet, what commonalities do they have amongst them?
Yeah, so the commonalities are that they are kind of general anti-inflammatory diets, which means that they have a lot of vegetables, a lot of fiber. That's really the foundation of these dietary patterns. And then
plant-based, as we like to say.
Yeah, plant-based diets. And so oftentimes there's, these good plants, very oftentimes colorful vegetables. Then they may incorporate healthy fats. And so that would be things like fatty fish, things like olive oil, things like nuts and seeds. Those are all generally components of these diets. There may be kind of unrefined carbohydrates, so like whole grains and things like that may be parts of these diets as well. The things that are limited are saturated fats, highly processed foods.
Seed oils.
Seed oils totally off the table for this kind of thing. So you want to...
The reason I say that is because a lot of them aren't saturated, and so people think that they're healthy, but actually they're still rather inflammatory.
They're very inflammatory, and in fact, these are polyunsaturated fats, but what they lack is they lack any antioxidants that help stabilize the lipids. So olive oil, for example, is an unsaturated fat, and that oil is stabilized because it has polyphenols, which are antioxidants, and that prevents the oils from becoming problematic in your body.
Very different than, say, the common seed oils that people often use in deep frying and things like that.
And so those would be oils like canola or sunflower or safflower or rice bran.
Which people used to think were healthy.
Yeah. And often are still presented as healthy, but they unfortunately are not healthy.
So we really want to minimize those.
We want to minimize them.
Okay.
And so diet is a big part of the equation. The other things that we know of as being helpful for cognitive function over time are, some of them are actually really simple. One of those is hearing, actually. And so what we know increasingly from a number of studies actually is that as people lose their hearing over time, if that's not addressed, that is associated with cognitive decline. So a simple intervention is having your hearing tested. This is especially true for patients who are older, but it may be true for younger patients as well. Sleep is critically important. And so a really low-hanging fruit when it comes to cognitive health is looking at your sleep quality. And so a common problem for sleep that people have is sleep apnea, which sometimes can be difficult to diagnose. But if untreated, that is a major driver of cognitive decline. Socialization is very important for cognitive health. And so many of the recent studies that have looked at comprehensive programs to reduce cognitive decline incorporate a socialization component. And so that includes spending time with family and friends and, being out in the world and engaging with people. In some of the programs, that is considered to be the most important part of the intervention, actually. And so, this is not something that we always think about, but simple things like that are associated with a good quality of life can really help cognitive function.
Really, all the things you're talking about that help with cognitive function are blue zones. Really living our life like those blue zones where people live longer, live better with fewer illnesses, less cognitive decline, less cancer, less everything.
Absolutely. And so like the key to health, the key to all of these things, whether it's cognitive decline or cancer or whatever chronic ailment you're thinking about, is like there are similarities here. Another important part of the blue zones is toxin exposure. And so the blue zones tend to be areas where, there's not a lot of air pollution. There's not a lot of pesticides and other residues in the food supply. And increasingly we're finding that air pollution, for example, is strongly associated with cognitive decline. And so something as simple as, if you live in an area where there's pollution, having an air filter in your house, a good quality air filter, can be like a really pretty simple thing to do that can have really important long-term implications.
So when you're evaluating patients who are concerned about their cognition or cognitive decline, what are the types of things that you look at in that initial assessment?
So one of the things that we do is we do cognitive testing. We try to get a quantified sense, a baseline of where they are. And there are a lot of, very well studied and validated tests that can help us understand, does this person have normal function? Do they have mild cognitive impairment? Or do they have dementia? With that baseline, we then look at other factors. We look at blood work. We look at how well their metabolism is working. And so that includes things like blood sugar. That includes things like cholesterol. It includes things like blood pressure. These are all fairly simple things, but we know that they can be associated with increased risk of cognitive decline if they're abnormal.
Do you also look at the genes?
We do look at genes. So we always look at ApoE4. There are a number of other genes that are also relevant. And so rather than testing just one gene, we actually test panels of genes that help us understand how someone's body is likely wired to operate. And depending on what their gene profile is, that can help us create really personalized interventions that can support them as individuals. We also think about the health of the microbiome, and so that's something that we consider. We may supplement the microbiome to support its health.
And what is that relationship between the gut microbiome and cognition?
Yeah, so we often think about this thing called the gut-brain connection. And so it seems like a weird thing that the gut would affect the health of the brain, but in fact, when you think of the areas of the body that have the highest concentrations of nerves and neurons, it's the brain and that's the gut. They're also connected not only from that standpoint, but they're connected chemically. And so when there's imbalances in the gut, it can lead to inflammation that can actually lead to breakdown of the blood-brain barrier. And that can lead to things like brain fog and difficulty with concentration. And so there's actually, surprisingly, a very tight connection between the health of the gut and the health of the brain.
And the flip side of that is when the gut is healthy and that microbiome, those microbiota are doing what they're supposed to be doing, they're creating things like short-chain fatty acids that make their way to the brain.
Exactly.
Having a stabilizing effect.
Mm-hmm. Yep, and so the gut becomes a really important source of food for the brain. And short-chain fatty acids are a really big part of that equation. So, we look at a wide variety of these things, and then we also kind of we try to get a sense of what's going on in someone's life. And so we think about hearing. We think about physical activity. We think about how, we generally now know that increased physical activity is also associated with improved cognition over time. We think about socialization. We think about toxin exposure. If someone has mold in their house, for example, or if someone lives next to a freeway, those are things that might be associated with cognitive decline. We think about how they're using their brain. If they're working, if they have a really engaged life, if they're doing brain games even.
Do they help, brain games?
They do. Yeah, they do actually. And they're incorporated into some of these programs that are designed to improve cognitive health over time. And so what we do when we look at all these we look at all these variables is we then come up with a plan to target which of those components might not be optimal for a specific person. And increasingly, I think what we're finding is that there's not a one-size-fits-all solution. And so every person needs a personalized approach. And B, what we're finding is that doing one thing isn't enough. You need to do multiple things. And there's some really exciting research that's coming out that has looked at programs that combine many of the factors that we're talking about and that are designed to actually not only help reduce progression of cognitive decline, but actually to reverse it as well.
And one of those factors that recent studies are really shining the spotlight on that I know you were probably just about to get to was the importance of exercise.
Mm-hmm. Yep. And so, all of these trials that are looking at complex or that are looking at interventions with multiple components to reduce cognitive decline, they all include exercise. And so the exercise that we're typically talking about is aerobic exercise, often with some components of strength training as well. And the general approach is to try to do at least 150 minutes a week of aerobic activity with strength training several days a week as well.
And what's important about that combination in terms of having as healthy a brain as possible?
Mm-hmm. So the aerobic activity helps with your cardiovascular fitness. And a healthy heart is part of the picture of a healthy brain. Healthy muscles and overall fitness is also important for brain health because muscles are actually an important organ in the body when it comes to metabolism. If someone is trying to improve their glucose control, for example, one of the best interventions is actually increasing muscle mass because muscles are kind of like sponges for glucose. And having diabetes or other impairments in blood sugar is a major risk factor for Alzheimer's. And so more muscle equals better glucose control.
I guess that's why some people refer to Alzheimer's as type 3 diabetes.
Yeah, exactly. Because it's almost always the case that there's some impaired metabolism when it comes to glucose function.
For the average person out there that wants to be as protective to their brains as possible, where do you suggest they start?
The best way to start is to look at your life. How is your diet? How is your sleep? What's your physical activity look like? Are you socially engaged? Do you have a close-knit group of friends that you're spending time with? Are you using your brain? Do you have a job or some other activity that is keeping you engaged and active? And then do you live in a place where you have potential for a lot of exposure to toxins and environmental pollutants? Because if so, those may be things that may be increasing your risk. And if any of those are present, then you can start by, kind of step by step removing them and adapting to them. And then the other thing that you can do is you can do testing. You can do cognitive testing. You can work with an integrative practitioner to kind of help understand what your risk is and to develop personalized interventions. Some of these interventions are some of the things that we've talked about. There are supplements that can be helpful as well. And so many of the studies that look at interventions to reduce cognitive decline include things like omega-3 fatty acids, include things like curcumin, which can be a beneficial anti-inflammatory medication, may include herbal therapies like ashwagandha or bacopa. They may also include other specialized types of supplements like there's one called nicotinamide riboside, for example, which is often included in some of these cognitive decline reduction protocols. Green coffee bean extract actually is also often used for these reasons. And so there's a whole host of things that have been studied quite rigorously and can be part of a protocol for an individual.
I think the great news is that there's such hope because many times a disease like Alzheimer's or having risk factors for a disease like Alzheimer's feels so hopeless, but really there's a lot people can do.
I think now more than ever, we have the knowledge and understanding of some of the risk factors that can lead to cognitive decline that creates a real sense of empowerment, of agency when it comes to not only preventing, but even reversing them in some cases.
And that's what's really the terrific news of the day is that studies are beginning to see that a rigorous lifestyle program can actually reverse some of those symptoms of Alzheimer's dementia when it's a frank diagnosis.
Mm-hmm. Yeah. This is a really exciting time and a great time for hope.
Well, it's a great place to end. Dr. Nate Handley, always a pleasure having you. Thanks for being with us today.
Thanks, Dr. Monti.